The coronavirus is spreading around the world, and so is the alarm. Countries are closing their borders and banning travel in an attempt to contain the outbreak. But are these measures enough, and how difficult is it to control the virus? This is Inside Story. Hello and welcome to the programme. I'm Darren Jordon. The coronavirus has so far killed more than 300 people, with at least 14,000 infected in over 20 countries. It's been just over a month since the disease was first detected in China's Wuhan city. A global health emergency has since been declared, and countries are racing to stop it spreading. But the ability of poorer countries to handle any outbreak is causing concern. Scott Heidler takes a look at the growing crisis in China.
One of the purpose-built coronavirus hospitals in Wuhan will open its doors on Monday. Another is due to go online in the coming days. Together, Chinese officials say more than 2,000 patients with the virus will be able to get care at the new facilities. But with urgent calls for more supplies and warnings of understaffed and overworked medical teams at the existing Wuhan hospitals, these new facilities will probably take some time before they can run at full capacity. This as the announcement health officials around the world have been bracing for: the first coronavirus death outside of China. A 44-year-old Chinese man from Wuhan died on Saturday in the Philippines.
In his last few days, the patient was stable and showed signs of improvement. However, the condition of the patient deteriorated within the last 24 hours, resulting in his demise.
More countries are flying their citizens out of Hubei province, and New Zealand has joined the list of nations barring non-citizens who have recently traveled to China from entering.
As this was supposed to be the end of the extended Lunar New Year holiday, the streets of Beijing should be bustling. But the government here has said only essential workers will return, the others not for another week at least. Businesses and private enterprises are doing the same.
Many are stuck inside their homes. Millions of Chinese are taking to social media to talk about the coronavirus, mostly venting frustration on the slow reaction of the Wuhan government when the virus was first discovered, and how donations have been diverted or delayed. This story about a TV crew stopped from reporting on the work of the Wuhan Red Cross received nearly 300,000 comments. Chinese officials are also taking to social media, using it to notify the public about details of cases of coronavirus. So those who traveled on the same flights, trains, or buses as infected patients and were possibly exposed can get tested to try and prevent the virus from spreading further. Scott Heidler, Al Jazeera, Beijing.
Well, countries around the world have announced measures to try to control the virus. The Philippines, New Zealand, US and Australia are denying entry to foreign visitors who've recently travelled to China. Russia and Vietnam are restricting visas. Singapore, Mongolia, Nepal and other nations have closed their borders with China. Governments are flying their citizens from China, and those coming from Hubei province, where the outbreak started, will be quarantined for 2 weeks. More airlines have suspended flights to China. Those include United and American Airlines, New Zealand Air, British Airways, Qatar Airways, Vietnam Airlines and others. But the World Health Organization has advised against such action. It says travel restrictions can hamper the supply of medicines and accelerate the spread of the virus. So let's introduce our panel of guests. In Hong Kong, Nicholas Thomas, an associate professor at the City University of Hong Kong. In Canberra, Australia, by Skype, Sanjaya Senanayake, a professor of infectious disease at the Australian National University. And from London, Mark Parrish, Regional Medical Director for Northern Europe at International SOS. Gentlemen, welcome to the programme. Sanjaya Senanayake, there in Canberra. Let me start with you, if I may, Sanjaya. I mean, the medical experts are telling us that coronavirus has surpassed Sars in terms of the number of infections. So what assessments are medical experts like yourself making that might reassure a very worried public?
I think the first thing is that the mortality rate is still very low. We're saying it's at least it's 2%, but the reality is there may be a lot of cases that we haven't detected, so it could be much lower than that. And we compare that to SARS, which was around 10 to 15%, and another coronavirus infection called MERS, which was 38%. And also at this stage, somewhat reassuring, is that outside China, even though cases have been detected in over 20 countries, there have been very few secondary cases. There have been some, but very few secondary cases in those countries.
Let's bring in Mark Parrish there in London. Mark, how worrying are these coronavirus numbers now? I mean, given the speed of the contagion, how concerned should the general public be? Because there seems to be a growing sense of anxiety, perhaps.
There does, doesn't there? And as Sanjay said, we should be maybe bear that in mind with the facts. I won't repeat those that he said, but I think we should also be aware of a couple of other things here. We have become aware of this virus very quickly. The outbreak was first detected in December. We obtained the molecular structure of the virus in January. That's been sent around the world, and we've now got tests that can diagnose it in us. The Chinese have done a fantastic job at quarantining Hubei and Wuhan, which is where it started. And we have certainly seen cases elsewhere around the world and in every province in China. And we know a lot about the virus. We don't know everything about the virus. I think we will get much better information about that virus in the next days and weeks, and we will then see how the outbreak progresses. But it's been contained and managed very well. Just to reinforce what was said before, most of us are not going to get this virus at all. If we do get it, which is very unlikely, we will get the symptoms of a cough and a cold that so many of us get during the winter period. It is very unlikely that we will become worse. And if we do become worse, then medical care is there to support us and help us. 2% of us at the moment look like we do die from it when we get it. Those tend to be, in fact, all of those cases so far have been the infirm and the elderly, and sadly those are the individuals who are more susceptible to these and so many diseases. So for us, it's a case of keep an eye on it. Let's look at where it's spread. There's a very good map on our website. You can see that spread, and and I think be realistic.
Let's bring in Nicholas Thomas there in Hong Kong. Nicholas, let me stay with the issue of public anxiety just for a second. I mean, is there a sense of panic in Asia, do you think? I mean, I just came back from Malaysia, where pharmacies there had completely run out of face masks and hand sanitizer. So what's the atmosphere like in Hong Kong? How worried are people there?
I think people are concerned, and they're getting more concerned here. I completely agree with the other two presenters, however, that when we look at the actual data, there isn't a great deal to actually be worried about at this time, especially given there are other seasonal flus going around. But I think the critical thing is that a lot of people aren't actually focusing or even trusting the official data we're seeing. There's a high degree of suspicion as to the message coming out of China, at least here within Hong Kong, as well as the message being given out by the Hong Kong government. And I think this is the other aspect to any form of epidemic or public health emergency, in that you have to have trust in the information channels that are providing the critical data. And when that trust starts to break down, you do see heightened levels of anxiety. As you said, in Malaysia, you've had runs on masks. Here in Hong Kong, if a pharmacy is alerted to the fact that it has face masks, if people are alerted to the fact a pharmacy has face masks, there are queues forming for hours outside. And people are getting quite frustrated when they can't get the masks, even though the masks themselves, especially the regular paper masks, don't necessarily protect you to any great extent from the virus.
Sanjaya in Canberra, let's bring you back into the discussion. I mean, do you think pop culture and the internet perhaps has helped increase a false awareness of the outbreak? I mean, when Hollywood produces zombie flicks like The Walking Dead, I mean, that inadvertently helps to scare people as well, doesn't it?
I think there's a fascination and an undercurrent of interest with pandemics. I mean, directly we've seen it with movies like Contagion, and as you correctly alluded to, The Walking Dead. I mean, as far as I'm concerned, every zombie movie and series is about an infection that is transmitted and does something nasty to you, and it's all about good infection control. So I think maybe there is that underlying worry, but of course there's also that realistic concern that's come about since SARS first appeared in 2002. We've had a few pandemic preparedness exercises with SARS, with Ebola, with swine flu. That has made the public more informed about what we worry about as health professionals and what could happen if a really nasty pandemic occurs.
Mark Parrish, your company, your organisation, International SOS, focuses on helping people and companies reduce exposure to and mitigate risks while travelling abroad. So what are you telling your clients about the dangers of the coronavirus?
Well, we're giving them the current facts and the fact that different countries are putting in place different measures to control this disease. It's important they're aware of that. Telling them how the disease is spread, which is by coughing and sneezing, by droplets, giving them some advice on how to prevent it, which is simple personal hygiene measures. And then we're also talking to them about having a plan in place for communicating this information to their employees, and also making sure that if they do have a case of coronavirus in one of their employees, which is most likely to be in China, what they should do, how they should manage that. Most companies have these plans in place. They have them for any sort of issue, and they would call it a crisis. They have crisis management teams. They'll have them for previous diseases such as Sars. They just need a little bit of reviewing for coronavirus and then making sure that that information is passed out to all of their teams to reassure them. Because it's concerning, isn't it? If you have a business in China and you have employees in China, you want to make sure that you're looking after them. We spend a lot of our time doing that. And again, as we've said, as the other two presenters here have said, it's giving that consistent fact-based message, balanced, of course, as you so rightly say, with some of the maybe less accurate information going around on the web and social media.
Nicholas Thomas in Hong Kong. I mean, various countries have taken steps to limit the spread of the virus with travel bans and border closures. We know that the Hong Kong government has said it won't close its border with China, and medical staff there have compounded the problem by saying, look, we're going to walk off the job. So how much could the political crisis there in Hong Kong impact on the response to the virus, do you think?
I think the political response for any virus, not just this particular one, is a critical component of the response strategy. Here in Hong Kong, of course, we've had 6 months of protests before we had the virus outbreak, and that has caused people to become a bit more suspicious of what the government says, a bit more unwilling to trust the government, even when, it has to be said, the Hong Kong government is actually pulling in some of the world's best experts, people who trained up under SARS and under subsequent outbreaks of H1N1 swine flu and also the H7N9 outbreak in 2013. But the lack of political trust sort of lingers in Hong Kong in a way that we didn't see with those earlier outbreaks. Frankly, I don't see that we can ever close our borders with China. That's not a realistic option. We'd be cutting off our food supply, for one thing, and would also be effectively closing the ports and causing a major economic disaster that way. So it has to be moderated. At the same time, we do see airlines shutting down their flights into China from around the region and around the world. But that's also balanced with the fact that Chinese flights are still leaving China. So I think there's a question here as to what the effect that such measures can actually play. Largely, I think they can be seen in terms of reassuring their domestic audiences. Yeah, I mean, Sanjaya there in Canberra. Sanjaya, the World Health Organization says these travel bans are actually counterproductive because they hinder the delivery of medicines and medical supplies and could actually increase the viral spread. What's your take on it? Do they have a point?
It can be an issue. That's definitely the case. And in fact, that's why the World Health Organization sometimes is reluctant to call a public health emergency of international concern, because they are worried that member states might impose trade and travel restrictions that they otherwise wouldn't have recommended. And I certainly think it's the global community's, the best way to get on top of this outbreak is by stopping it in China. So I think if we can throw a lot of resources at China, which we probably can do because we're not having local spread within our own countries, that would be a good idea.
Mark Parrish, let me pick up on the point that Sanjaya just made there. I mean, what's your assessment then of how China is handling this outbreak in terms of its response? I mean, has Beijing learned from previous outbreaks and got this one right, do you think? Yes, I think they have.
There was a much slower response to the SARS outbreak 17 or so years ago, and that certainly affected management of SARS and I think affected its spread elsewhere outside China. This time, if we look at it, the Chinese have been fast, and they have transmitted information. They've been very open about it, from sending the molecular information about the virus around the world so that we could all look at that and make testing for it, keeping everybody updated with the numbers of cases that were occurring, and locking down Wuhan and other cities in Hubei province. It's no easy thing to lock down a city of 10 million or so people, and yet the Chinese have done that. And if we look at that, that will make a significant difference to the spread of this infection and is likely to stop it spreading. I'm sure we will still see some other cases popping up around the world outside China and other cases in China, because before they locked down the city, so many Chinese had moved elsewhere for the Chinese New Year. But go back a little bit, the incubation level of time of this virus is about 14 days. It's now the 2nd of February, and I think Wuhan was locked down on the 21st of January. So we're getting to that 2-week period, and it'll be after that. It'll be interesting to see if the number of infections, the count, tails off as this lockdown has worked.
So let's put that point then to Sanjaya there in Canberra. Sanjaya, what's your assessment then of how China has managed this? Have they got it right?
I think they're doing an extraordinary thing that very few other countries could do, to lock down cities of totaling almost 60 million people is just extraordinary. I still can't get my head around it. And as Mark correctly says, at that 2-week mark after implementing that intervention, that will start to give us an idea of whether they've been successful or not. Of course, now we're seeing 2,000 cases, new cases being confirmed every day, but let's give it a few days and see where we're headed.
Yeah, and Nicholas Thomas, I mean, we've seen the first death now outside China. I mean, a Chinese man in the Philippines has died from the virus. How much alarm is that likely to create, being the first death outside of mainland China?
I think within the social media, this has been picked up, especially within the Chinese social media, this has been picked up as an issue. But I'd reiterate what the other two speakers said. There hasn't necessarily been a perfect implementation of the quarantine, but we still are seeing the virus largely centred in Wuhan and the surrounding cities. Still today, you've got 96% roughly of all deaths still in that immediate vicinity. And although we are seeing it spreading more generally within the Chinese population, it's not as rapid, I think it's fair to observe, had those quarantine measures not been perfectly implemented. So I think this is an example of China learning from previous outbreaks, perhaps still needing to fix up a couple of issues in terms of the political and policy side of things, but certainly on the technical and biomedical side, working very well and very closely with the international community.
And Mark Parrish in London, we know there's no vaccine for the coronavirus at the moment, sadly. We know the experts are rushing to make one. Talk us through some of the difficulties you think they face in bringing out a vaccine very quickly.
I'm not an expert on vaccine development, but I know that it does take a lot of time to go from having the molecular structure of a virus or a bacteria and then being able to create a vaccine for that. It can take many years to do that. For instance, we still don't have a vaccine for HIV, and we've only just started trialling and using vaccines for Ebola, despite having known Ebola for a very long time. To go back to just the previous point about incubation periods and what we're going to see maybe in the next few days or week or so, and whether these numbers tail off, it's not an exact science, any of this. And I don't think we should expect to see exactly at 2 weeks, numbers will start tailing off, because there are so many other variables in play here. And I'm sure that so many people travelled out of Wuhan before that quarantine ban was put in place. But I do believe that given all that's happened with this outbreak, the Chinese have done and continue to do a phenomenal job, which, as I'd agree with Sanjay, it'd be very hard for other countries to do, to quarantine 60 million or so people and stop the spread. That's what's going to stop the spread. And interestingly, that's no different to hundreds of years of public health measures. If you go back to the very first example of this, which was John Snow and the Broad Street pump in Soho, not far from here, where he stopped cholera. He'd done a little map of where cholera had been broken out in Soho. He'd traced the main point of contact with that, in fact, was a water pump. He took the handle off the water pump to stop the locals using the water. Cholera went away. We're just trying to do the same thing now. We're just doing it on a bigger scale. And that's what's going to be most successful in the next few weeks.
Yeah, I mean, I don't know if Jon Snow's efforts can help to stop this virus, but I mean, Sanjay, let me ask you, I mean, can medical experts use the lessons from the outbreak of Sars and Ebola and MERS and so on and helping them to fight this virus? Because there's always a worry that many African countries, for instance, don't have the resources to tackle a major contagion like this.
Yes, well, interestingly, you bring up Africa, and Africa as a continent has not had a case as far as we know. And really, if you think about Africa, there are some areas which are better resourced than others. And for example, the Democratic Republic of Congo, despite militias and a number of infighting, they've still managed to contain the second largest Ebola outbreak, which is currently going on within its borders largely. So I think at the moment, Africa is doing okay, but you do raise the issue of what happens if less resourced, less developed countries have importation of cases. And that is true. If there is going to be, I guess, an Achilles heel in a global response, that could be where things fail, because they may not have the ability or the resources to identify and isolate all the cases, which might cause some local transmission within that country or region.
Nicholas, in Hong Kong, I mean, what lessons can we learn then from previous global viral outbreaks like SARS, like Ebola? Are we better prepared this time around, do you think?
I think certainly on the technical side, with the technical cooperation between the WHO, the US CDC, the Chinese CDC, and their regional counterparts, we're much better prepared than what we were 16 or so years ago. Just to pick up, though, on the Achilles heel idea that was just mentioned, it's not just internationally in poorer countries. You have to realise that parts of China, where people will be moving to throughout the Chinese New Year, are themselves very poor. And so you're going to have structural imbalances within China as to the way this disease gets dealt with. The bigger cities, Beijing, Shanghai, Tianjin, and so on, they'll be able to deal with the outbreak because they have the infrastructure. But once you get outside those cities into more rural areas, and 48% or so of the Chinese population, roughly, is still living in rural areas, you're going to start to see some cases getting missed. Now, I'd agree with what we started off with, that most people who get this are simply going to have a bad flu. But it does lead to questions of capacity for China to deal with in the more remote areas outside the central outbreak zone.
We're just pushed for time, so let me get a final question into Mark Parrish. Mark, what's the situation there in the UK? We know the National Health Service has just rolled out a public awareness campaign. There are dozens of people who've been quarantined, but the UK, of course, has been busy with Brexit. So what's been happening there?
Yes, I wouldn't necessarily link Brexit to dealing with a public health issue, because the two are very different, and that the UK has very well tried and tested plans for outbreaks of infectious diseases such as this. We've had a couple of cases identified now in the UK. They've been managed very well. The UK authorities now trying to find other people that have come from Wuhan at the same time as having flown some people back from Wuhan, and they're in quarantine. So again, it's all this balance, but we have in place all of the things that we need to deal with an outbreak like this, irrespective of Brexit.
Just a final thought to you, Sanjay. Everyone, of course, is wondering how long this outbreak will last. Is that something the experts can answer at this stage, very briefly?
I can give you a confident I don't know, because, look, at the end of the day, this is a novel virus, and even though it seems like we've been at it for a long time, I think we're only into the 8th week, and we're still seeing the number of cases accelerate. So we'll just have to watch this space.
Well, gentlemen, that's all the time we have today. Thank you very much indeed for your insight. In Hong Kong, Nicholas Thomas. In Canberra, Australia, Sanjaya Senanayake. And in London, Mark Parrish. Gentlemen, thank you all very much indeed. And thank you too for watching. You can see the programme again anytime by visiting our website, aljazeera.com. And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. And you can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Darren Jordon, and the whole team here, goodbye for now.